Hi, my name's Matt. I'm a student nurse. I was wondering if
Hi,
I
Matt.
could follow you around while you give medications today.
Yeah, that'd be great.
Okay. So I think they said to follow you in 620. Can you tell me a little bit about the patient?
Yeah, sure. Room 620, it's a 67-year-old gentleman named Levi Restivo. He's full code. He was brought here from his doctor's office into the ER. Dr. Phillips is his physician there. His primary diagnosis is a stage 2 diabetic ulcer on his right heel. His secondary diagnosis is that he's type 2 diabetic. He's had elevated blood glucose over 300 for the last 5 days. He has been diabetic for 20 years and is insulin dependent. His current allergies listed are dog hair, tetracycline, and peanuts. He is oriented ×4. He has perla and ocular movement. His pain was a 6 out of 10 coming in, but he was given morphine, so now it's a 1 out of 10. His lungs are clear in all the lobes, but diminished in the bases. His heart sounds were normal. You could hear the S1 and S2. His vitals were normal, but we are still currently checking them every 8 hours. He has no current edema. He wears SCDs in bed. He is currently on the 1,800 calorie diabetic diet. His last blood glucose was 290, and if it gets over 300 again, we're supposed to call the physician. We are monitoring his eyes and nose, and we'll notify the physician if his urine output is less than 30 mils an hour. He has not had a bowel movement yet, but states he had a normal one 2 days ago. And we are currently awaiting a wound care consult for his pressure ulcer, which is a dry sterile dressing right now that we've been changing twice a day. He has an IV in his right arm and is scheduled to receive normal saline at 30 mils an hour. And we also have consults scheduled for the morning with a physical and occupational therapist.
Okay. So why specifically is the client receiving this medication, and what actions does this medication have on the body?
Well, the client is receiving the vancomycin for the infection in the right heel pressure ulcer. It is destroying the cell wall, the bacteria, and that's how it works to kill the infection and fight the fever. He gets the insulin to maintain his normal blood glucose levels, which, that should be between 7 and 120. And then he receives the lisinopril for his heart rate to keep him within normal blood pressure parameters. And also he was reporting some tingling in his foot, and being diabetic, they're concerned about diabetic neuropathy. So hopefully that will help alleviate that too.
And when should you question the administration of this medication? And what is this medication? Does it have a serum level? And do you have to monitor any vital signs?
Yeah, you would, with the vancomycin, you would make sure that there was no renal impairment in the patient. And you would want to make sure if he was getting a second dose, to make sure you pull his blood serum to check it. Therapeutic level for its peak is 20 to 40, and for its trough it's 5 to 10. And you want to pull it 30 minutes before giving a second administration to make sure it's in a trough level.
Okay.
And then insulin, you would not administer it if his blood glucose was below 70. And then also with the lisinopril, you'd want to monitor his vital signs to make sure his blood pressure and heart rate were high enough to be able to receiving that medicine, because it drops them.
Okay. What interventions should be taught to the client to ensure the medication is administered safely in the hospital setting? And what interventions must be taught for taking the medication safely at home?
We would want to teach the patient properly with the insulin how to check his own blood glucose, and also be able to pull the medicine for the injection site and change the injection sites from each time that they give it. And then also with the lisinopril, you should be giving it every day at the same time, so the blood pressure isn't getting double dosed. Yeah.
Was he getting 2 or 3 medicines?
Oh, and the Vanco, you wouldn't need to teach him anything about home education, because, he's not going to be going home with it. It's an IV piggyback. But while he's here, you just tell him to look out for any of the warning signs, like being a rash or, I don't know what else, but, ototoxicity and nephrotoxicity are some of the side effects. So.
Okay. So you went over some of the side effects and potential adverse reactions. Was there any others?
Well, with Vanco, you might want to, the flushing and the hypotension and the rash is a sign of red man syndrome, so you want to watch out for that. And then for the insulin, you want to watch out for hypoglycemia, hyperkalemia, and hypokalemia. And then with the lisinopril, you'd want to watch for the cough, headache, or dizziness. Adverse effects would be the angioedema and the anulocytosis and hepatotoxicity.
Okay, and how would we know if these medications are effective?
With the Vanco, we would know because in the labs it would show the white blood count would have gone down.
Okay.
And then we would also know that the fever would get better. And also with the insulin, you would know it was working because the blood glucose levels would stay in the right parameters. And also with the lisinopril, the blood pressure and heart rate would not be elevated.
Okay. All right.
Would you like to come watch me?
Absolutely.
Okay.
Come in.
Hi, Mr. Lestivo. How are you doing today?
Good, thank you. How are you?
Good. This is my student nurse, Matt. He's going to be helping and watching me hang your medicines. Today you're going to be getting just a saline drip with piggyback of vancomycin and your lisinopril oral tablet and your insulin injection for your elevated blood glucose.
Okay.
Do you have any allergies?
Yeah, peanuts, tetracycline, and dog hair.
Okay. Let's pull you up in the computer first and foremost, okay?
All right.
Let's see. So, this is Levi Restivo. He's 67. Let's go see if we can get you your charting. Maybe this one doesn't have your medications in it. Maybe the internet died, so we'll go back in. It is storming pretty bad out. All right. So you said your allergies were tetracycline, dog hair, and peanuts, right?
Yep.
Let me just check your armband, make sure that's what they have on here as well. Perfect. All right, you always want to wash your hands first and foremost. All right. So I'm just going to check your IV site.
Okay.
Make sure there's no infiltration. Anything bothering you here?
No, it feels great.
Feels great? All right. Looks good. Looks clean and dry. Great. All right. Now we're going to don some clean gloves. And we're going to check the physician's orders. Sometimes it's a little tricky when your hands are still a little wet. A little tricky. Oh, a little tricky. Okay. I'm just checking your orders, okay?
All right.
Oh yeah, here we go. So it does show the saline and The Venco and everything that's in here looks good. Alright, so what I'm going to do first is pull up the mar, and then we're going to hang the normal saline, okay?
Okay.
So here it is in here. Alright, so here's our saline that we're going to be giving Mr. Estevo. And you always want to check it, make sure there's no sediment in it or anything that looks weird about it. This looks good. You want to check the expiration date, which this is good, October of 18, so we're good there. And what we're going to do is, can you tell me your name and age?
Levi Restivo, 67.
Alright. And we don't have a scanner today, so we're just going to have to enter your number.
Okay.
Mm-hmm. I like your stuffed animal.
Thanks.
686-764 5607. Okay. And now we're going to enter the medication barcode, which is D9B 902. Sorry, it's so small. So now we have the green light verified. So now we are going to spike our bag. You want to make sure you don't get any of these on the floor. And then kind of untangle it. And then we are going to unclamp. Prime the line. So we get all the air bubbles. And we are good. So reclamp. Alright, and now we are going to hang this right here for 1 second, and then we're going to scrub your head for 15 seconds and flush your line. Make sure there's no problem there, okay?
Okay.
Alright. We'll do this for 15 seconds. Alright, you let me know if you have any pain or stinging, okay?
Okay.
So, clamps.
Feels
Feel
good.
anything?
Nope.
Alright. I'm gonna hook up your saline, okay?
Okay.
And we're going to scrub the hub again, just for precaution. It's a lot of scrubbing of the hub. Hold on 1 second, our pump isn't working properly.
Okay.
I'll be right back. our pump isn't working. We just wanted to let you know, but we do have an old trusty data flow that we're going to use on this patient. If that's okay with you?
Roger, charging us out.
Okay. Alright, so sorry about that. Sometimes, things don't work out. So we're going to now use this trusty little dial-a-flow. So since I had to leave the room, I'm going to be washing my hands again, donning new gloves, and hooking up with the dial-a-flow. Never prepare for, gotta troubleshoot sometimes. Okay. As good as we're gonna get. These are serial, so you don't have to do the hub on that one. This remains serial, and we're just going to hook it up. And it's supposed to be 30 mil, so we're going to set it to 30 on the blue, like that. And we are going to unplug our IV. And you should just see it drip. There we go. All right. So, the site is the right arm. The time is 1700. And my initials. And we will save. All right, now we are going to do the vancomycin piggyback. So, once again, we're going to go to the patient. And can you verify your name and age again for me, Mr. Restivo?
Levi Restivo, 67.
All right, and we're going to verify that in there. Can you read me that number, please?
686 764 5607.
Okay. And you don't have any allergies to vancomycin?
No.
Okay. And then we're going to put in the barcode of the medicine. You have the green light to go. You always want to make sure that you check the amount, the expiration, and the 5 rights, which is the right patient, right drug, right dose, right route, right time for every medication you give, okay?
Okay.
All right. Alright. So with the Vanco, we're going to go do the same thing like we did with the saline. We're going to spike it. always gonna move this lower than your main medicine that's going in, because you want this to hang higher. And this one up here. Fill the chamber. And then we're going to prime the line. Hopefully. So we're going to clamp that. And then we are going to scrub the hub for 15 seconds. Alright, before we unclamp it, this one's going to be, it's 250 milliliters over 2 hours, so we're going to do 125 on the dial-flow per hour, just like that. And then we will unclamp this. And Mr. Recibo is now receiving his medicine. So, the time was 1700. And my initials. And you want to put in the dose, which is 250. Oh, yes, 1500 milliliters. Okay. And then we're going to save that. All right, so next we're going to give the insulin. All right, sorry, Mr. Receiver, just one more time.
Okay.
Actually, two more. Can you verify your name and age?
Levi Restivo, 67.
All right. And is it 686?
Yep. 764
Uh-huh.
5607.
All right, so the medication barcode. All right, so we have the green light to proceed, but you want to do the 5 rights again. Make sure it's the right patient, right dose, right route, right time, and right drug. And against the MAR, you want to check that as well. Make sure it's the right amount. And right here you can see that because his glucose was 290, the physician did a sliding scale, so he gets 16 units today because it was 290. Had he gotten less, he would have gotten 12 units and 8 units was our sliding scale. All right, so we're going to take a fresh alcohol wipe. So you want to wipe the top of this to make sure it's clean. And this you want to make sure that the expiration is right, which it is. And then we're going to get your needle out. And so, Mr. Aceva, where did you give your last injection?
My left upper quadrant.
Alright. So because he got it in the left upper quadrant, we'll do the left lower quadrant. And we'll just swab that. Get that all clean, ready to go. And with insulin, you're going to want to pull back 16 units of air because he's getting 16 units of insulin. Would you like to check that for me, nurse? No? Well, I'd like a nurse to double check it, so I'll get another nurse.
Yeah, I'm a student. I don't feel comfortable checking it. Here.
Charge nurse.
Here I am. Oh, it looks good. 16 units.
Okay, thank you so much, Charge. Okay, now we're going to come over and give it to Mr. Estevo. And you just go in at a 90-degree angle. Maybe. And there we go. And it goes straight to the sharps box. Okay, and this was given at 1500. I mean 1700, sorry. And we gave it in the left lower abdomen. And it was, we'll just put in, the CBG was 290, so he got 16 units. In the left lower abdomen. And then you save it, if it'll save. Alright. And finally, sir, we're going to give you your pill.
Okay.
Do you have any problems swallowing?
No, I'm fine.
Okay. One more time, can you verify your name and age?
Levi Restivo, 67.
Alright. Can you read me that barcode again, please?
Yeah, 686 764 5607.
Okay, let's find your listen code.
That's weird. The patient next door is getting the same medicine.
Well, it's that time. They usually do it around now.
Must be like cardboard walls.
So we got the green light for the verification. Once again, you want to check the 5 rights: the patient, the drug, the dose, the route, the time. And then you also always want to make sure your medicine is not expired and it's the right dose, which is 10 milligrams. It's not expired. All good to go with this. Alright, Mr. Restivo. Here's some water for you.
Thank you very much.
Can you open your mouth for me? Good. Good job. Okay. Alright. Now, I know that you had requested some information, which I will give it to you in a little bit, okay? I'm just going to finish filling out this paperwork and I'll give it right for you, okay?
Okay.
And then this was also given at 1700. And this was 10 milligram oral. Patient had no problem swallowing. All right. And just so you know, with these IV lines, you want to make sure you put your initials and the date that they were done. So the nurse can change the line. And they know when it was hung. now I'm going to give you these are all your sheets on the medication you're currently on that you requested.
Okay, thank you very much.
Did you have any questions about the medications?
No questions.
Can you tell me 2 things about insulin that you were taught today?
Yeah, I have to make sure that I switch my sites every time I get an injection, and that I need to make sure that I watch for signs of being hypoglycemic.
All right. Is there anything else that you could teach me about the lisinopril that you might want to monitor when you're taking that home?
My blood pressure.
Good job. Yeah. All right. Well, if there's anything else I can do for you, I'm just going to make sure you have your call light. And did you need anything else?
No, I'm good, thank you.
All right. So I'm just gonna wash my hands before I leave, and you just hit that call light if you need anything. Okay?
All right, thank you.
Wow, that was fun. Thank you.
Thank you, Matt. I really have really enjoyed that too.
So I had a couple more questions for you now that we're outside the room and everyone can hear us. So
I love these questions. These are just a hoot.
yeah, were there any pertinent pieces of information you reviewed before administering the client any of these medications?
Definitely reviewed the client's allergies and reviewed to make sure that it was the 5 rights of the medication, and also you wanted to make sure the blood glucose level was adequate and the blood pressure was adequate for the medications.
Did any of the information that you received affect your decision to administer the medication?
It did not affect my decision because the patient did not have any allergies to the medications, and both the insulin level, the blood glucose level, and the blood pressure were adequate for the lisinopril and insulin.
Did this information affect how you administered the medication?
Yeah. Had the client had too low of a blood glucose, I would not have administered the insulin. Same with the blood pressure. I would not have administered the lisinopril if her blood pressure was too low. And also with the Vanco, had she had any allergies to it, I would not have administered that IV piggyback.
Okay, thank you.
Yeah. Anything else I can do for you?
No, thank you.
All right. Thank you.